More on quarantines and guidelines surrounding the Ebola epidemic. Walter Tsou joins us now in Philadelphia. He's the former health commissioner of Philadelphia and the past president of the American Public Health Association. He's also a consultant on public health and healthcare reform. Walter, you just heard Jim say chaotic, kind of confused. CDC coming out with new guidelines. Do you agree with what they've outlined, and is it going to make much of a difference?
Well, I think the good thing about the CDC guidelines is based on science, and it's an effort to try to put some clarity to much of the confusion that's out there. It's been long overdue, I believe, and it's a welcome sign in public health.
You mentioned based on science. You were on the broadcast with us earlier this month, and you said the U.S. really needs to have an open door policy for people returning from the region who might be infected. Australia, as you know, taking a more closed door policy, saying basically no thank you, instituting an Ebola-prompted ban on travel from West Africa. And I wanted to get your thoughts on that.
Well, I think we have a good track record right here in the United States on caring for Ebola. We have multiple episodes where we can do screening at the airports. We have close monitoring by those who have arrived in the country. And we've been very clear about our guidelines in terms of making sure that those who may have been exposed to Ebola are actually asked to self-monitor themselves at home with temperatures reported to health authorities. And this has been working very well for us in this country.
Walter, I'll just go back to those three words again because you hit them right off the bat based on science. We're seeing science, but we're also seeing politics. I mentioned Australia. They're saying we're not going to issue visas for people. We've seen the governors in New Jersey and New York. They've been criticized for their procedures. An expert on our broadcast yesterday indicating that the politicians don't really understand Ebola, the science around it, and health officials do, and that the politicians are kind of injecting themselves into all of this, and that's leading to stigma and hysteria. Would you agree with him?
I do think that there's a lot of politics that should probably not be interjected. There is a science here. Just as an example, we know that we've tracked household contacts of people who have Ebola. 78 people who were contacted, for example, not one of them has come down with Ebola. So we know that people who have had much closer contact than many of the health workers that have come back have not contracted Ebola. We think that these CDC guidelines are exercising good science and precautions.
You're in the public health field. It seems as though in the last few days at least, the conversation sort of shifted. It doesn't seem like people are talking as much about vaccines and treatment and coming to the aid of the area that's been hammered by the virus. It seems like a lot of the conversation now about these particular stories that are cropping up. How frustrating is that for you?
It's extremely frustrating. I mean, we've known about Ebola since 1976. We've known that it's been very deadly. It happens to be in a very impoverished part of the world in Africa. And many of the pharmaceutical companies and the researchers have just simply not put their money into trying to find a vaccine or cure. The good news, I think, is that this has been a wake-up call for the world as to how serious Ebola can be. And I think now we're getting the type of proper attention to developing a vaccine and a treatment.
Walter, you were talking about good news. I saw today that there is some good news. Hearing that Doctors Without Borders now saying that they are seeing a huge reduction in cases in Foya in Liberia, and that's of course an area that borders Guinea and Sierra Leone, went from a peak of about 100 cases. Now it's down to just basically a handful. They haven't seen any new cases in that town in about a month. Is that how we're going to turn the corner on this? It's going to be one small town turning the corner at a time. I mean, how do you see this thing kind of ratcheting down?
Well, I think that's a perfect example that we're using personal protective equipment. We're using an abundance of caution in caring for Ebola patients. We're minimizing any amount of contact, and that is how we're going to stop this epidemic that's happening out there. Unfortunately, we've had thousands of people who have already passed away because we were not careful enough about those precautions. We've learned a lot about Ebola from the most recent episodes, and those lessons are being used right now to help stem the epidemic.
Walter Tsou joining us from Philadelphia. Can't thank you enough.